Hey everyone, welcome back to New Method Live. I just have to say this. You have never heard me talk about vaginas in any of my episodes, but on this episode, I think I said it every other word because I interviewed Isa Herrera, who is the founder of PelvicPainRelief.com. You're not going to want to miss this because she's going to tell you a story about her purple vagina. That's right. You heard it right. You're going to have to listen to see what I'm talking about. She's a licensed women's health physical therapist. She's helped over 20,000 women with pelvic floor dysfunction, first in her healing center in New York, and now all over the world, she does things virtually. I learned so much in this episode about pelvic floor dysfunction. I had no idea. And by the way, it's not just for women. So if you have a pelvic floor, which we all do, you're going to want to hear this episode. So without further ado, let's jump in and meet Isa. Oh my God, Isa, I am so excited that you're here. By the way, don't call her Isabella. Only her mom calls her Isabella. It's Isa. I had the honor of being on your show. It was really so exciting. Thank you for that with your clients. And, you know, this is a topic that a lot of people don't talk about. And probably so many more people have it than they're willing to discuss. Or maybe they don't even realize it's an issue. Maybe they think, oh, this is just normal part of aging or whatever. Tell me how you got into, right? It's so niche, like pelvic floor, physical therapist. Like, how did you get into this? Walk us through the story.
Okay, well, first of all, thank you for having me on your podcast.
Oh, yeah.
Super excited to share this knowledge with your community about the pelvic floor. And that's a great question because they say at the moment of your deep suffering, you know, you either find meaning or you go down the rabbit hole of despair. And for a long time, you know, I had no idea what the pelvic floor was. Now, I had spent a year in medical school. I had been through physical therapy, PT school, and yet we got like a 30-minute lecture on the pelvic floor, right? And then after I had my baby, my pelvic floor just blew up, okay? That's when you know you have a pelvic floor. Right?
What do you mean? What does that mean, blew up? What does that mean?
I mean, listen, you know, everything from the outside looked normal. But I had pain, I was leaky, I had pressure, I couldn't sit, I couldn't breastfeed. But every time I went back to my doctor, he would say, but everything looks really good on the outside. Which is interestingly enough, right?
You're
fine. Everything is in your head, you know. He said, go home, you're stressed out, have a glass of wine. And I just kept believing that story over and over again until one day I hit the wall. I was despondent. I was depressed. I was like at the end of my rope, and I was like, nah, this can't be the way. There has to be an answer to this. And I went and I did all this research. I shadowed some doctors and I took some classes, and that's when I understood about the pelvic floor and what I was having. And just because something is common doesn't mean that it's normal, right?
Yes, preach. That's like the story of my life. Okay.
Serious, right?
What was your ultimate diagnosis for you?
My ultimate diagnosis actually never really came. But I know now that it was a tear of my pelvic floor wall. I diagnosed myself after educating myself and going to doctors. And by the way, I went to every doctor in New York City, pelvic pain doctor, right? I went to a holistic gynecologist. And what I discovered was when I had this internal tear, it had created a lot of scar tissue, because we know scar tissue is a normal response to any kind of injury or inflammation. And it had developed some scar tissue. The scar tissue had enveloped my nerve. So I was getting this stabbing vaginal pain constantly. And they were like, well, I don't know, here's some Botox, okay, did that. Here's some antibiotics, did that. Here's some Neurontin, did that. And I was on what I call the Dr. Rose show, right? I called it the Dr. Rose show. And then finally I was like, I'm done. This is a muscle, and this is a body part that will respond to natural therapies and natural treatments. And then that's when I discovered vaginal massage. That's when I discovered that Kegels were making me worse.
Wait.
Right?
Hold on. That's crazy. That's going to be a mic drop. So hold on. Let me get us to where you are right now, because Kegel's making it worse. Like, newsflash. I'm coming back to that, listeners. 1 second. First of all, I just have to unpack so much of what you said, because what you were describing is so many of my patients' journeys, which is, first of all, you said, before we get to that, you spend 30 minutes on pelvic floor. I think you spend 20 minutes on nutrition in any kind of medical or NP or PA school, right? So I'm with you, sister. The things that really ail so many of our mutual clients, we never learned in school. That pelvic floor, schmelvic floor, who cares? Nutrition, who cares, right?
Exactly.
I had to first, because when you said that, I was laughing. Second, The other common thing that you experienced, and I experienced this with my wife, is the Dr. Rhodes, what did you call it? Dr. Rhodes show?
The Dr. Rose show.
I love that. It's funny because on the one hand, it's a prerequisite to come see me. I really don't want to see someone who's never been to a doctor, and I'm sure you're the same way. Like, go, do the thing, go everywhere, get every test, get every MRI, get every ultrasound, get it. Don't skip that part because you want to rule out a big pathology. But if they tell you that everything is normal and you don't feel normal, it's time to find someone like Issa, someone like me for whatever your situation is. It doesn't end in conventional medicine. That's just the beginning. It doesn't end. Okay, so in your case, they told you everything was fine, but meanwhile, you can't sit down. How about sex? Was sex painful? Excuse me for asking. Not possible.
Had no sex. My marriage was like impossible.
Oh my
God.
God.
They don't tell you this. And the thing is, 30 million women in the U.S. suffer from chronic sexual pain, chronic pelvic pain, 1 out of 3. So it's a very common thing. Yet it's like, hush.
Oh, yeah. Can't talk about that.
You know, they just say, oh, yeah, you go for your 6-week checkup, go have sex, go run, do all the things, jump up, you know. And I was like, I can't do I can't even sit.
6 weeks, oh, that's so funny. I love that 6 weeks is like this magic number. Like, what? 6 weeks? I just had a whole ass human come out of my vagina. 6 weeks? Exactly. What are you talking about? So what does that even mean, 6 weeks? Okay. Oh, my God, this is crazy. Okay, so you were told everything is normal. And then you realized that I had to work on yourself. Tell me the realization. And now I need this mic drop of, I found out the Kegels were making me worse. How? That's not what we learned. Explain.
Well, I'm going to tell you about my purple vagina moment. That was my moment. So I'm desperate.
Yeah.
Like many women out there, we get desperate for answers and we try stuff that, you know, maybe we should have. It's called informed consent, but whatever. Listen. So I go to this holistic doctor. She charges me like $750. In those days, that was a hell of a lot of money. Okay.
Still a lot right? Back then, sure.
I go to her and I tell her what I'm happening. She goes, I have a treatment for you. And she pours a purple chemical on my vagina. Right.
Okay.
She says, this is going to heal you. This is just some atrophy issues. Meanwhile, it was my pelvic floor and I had scar tissue. Right. She was completely wrong. And so as I walked out of that doctor's office with my purple vagina, seriously, I swear to God, I'm making this up. I had an aha moment that would heal me and thousands of other women. And I said, they got this all wrong. Because I knew enough about science. I knew enough about the body. I come from a tradition of holistic healers. And so when I left her office and I was at this rock bottom and I go home and show my husband my purple vagina, nevertheless,
I'm dead.
I'm dying. Okay. I realized that I wasn't applying the principles, that I was looking external to myself for someone to heal me and save me. And I had gotten it all wrong. And you know what? So what? So if you get it wrong, it's not a big deal. It's
not a big deal. Keep going. You got to get it wrong to get it right. You got to get it wrong to get it right.
Exactly. And it was that moment where people say, well, it wasn't the Botox injection that destroyed me. It wasn't the medications, the antibiotics. It was that moment moment when I thought.
Purple vagina moment.
Yeah. And I thought that this doctor was going to, like, she was holistic. She had this great reputation. You know, you go in with a lot of hope.
Yeah.
This individual's going to be the one, right? But really the one is you. That's what we forget. You're the one.
Oh, true. You got to do the thing. So what did you do?
So I started researching and I started discovering that there was a branch of physical therapy that I never knew about for the pelvic floor. And I was like, whoa, hold on, horses, right? And then I started researching it. I started taking courses, like anything. I was ferocious. Anything that I could absorb, any information, any material, any doctor, any PT that I can follow, anyone. And I just learned how to heal myself. And it took me longer because there wasn't podcasts like this. There wasn't like communities. Like
back then, it was
nothing. Now that at least talking about the pelvic floor, I started understanding that the vagina needs internal work, that it needs to be exercised, that we need to pay attention to this very vital part of our bodies, but we only pay attention to it when there's something going wrong, right? You got a yeast infection. You have a baby.
Wrong. Otherwise, forget it. We don't need it.
Otherwise, we're not even exercising it, right? So I said, I know. I'm going to do a bunch of Kegels because my
Of course,
doctor went
that
back to
we've
my
learned that
doctor.
forever. That's the only exercise around is a Kegel.
Exactly. So I go back to my doctor and he goes, yeah, Issa, why don't you just do a bunch of Kegels? You diagnose yourself basically pelvic floor dysfunction. I'm like, okay. So I go and do a bunch of Kegels. I ended up in the emergency room with severe pelvic pain on painkillers.
Why? What did it do for you?
Because it took my vagina, which was already tight. And many of us don't understand that pelvic floor dysfunction isn't simply about being loose and big and relaxed. There's a whole another side that says that you're tense, that you're scarred, that you have pain.
Like almost spasmed?
Spasms galore.
So you're spasmed, and now you're basically spasming more. Like a Kegel is just
it's another
voluntary spasm.
Right. And that's when I came up with this whole thing called reverse Kegels. And I think that I'm the first one to coin it. Now everybody uses it. I didn't.
God, you just said it, and now I'm trying to do it. What?
Yeah. Is it?
Anyone listening, you're trying to reverse Kegel in your head.
And the thing
not in your head.
No, it's true. Not yeah. But the thing is, when you're doing, if something comes up, it must come down.
Yeah,
right?
yeah.
But when I was doing my Kegels, I was just contracting like a maniac. I didn't know anything about relaxation. I didn't know anything about creating balance and coordination and having a supple, flexible, relaxed, but yet toned pelvic floor that can maintain postural alignment and all the other stuff the pelvic floor does. So now I know that if you're contracting, you have to relax and open. And Kegels for women who have tight vagina, scarred vagina, spasm vagina, sexual pain, vulvodynia, vaginismus, interstitial cystitis, may not be the exercise for you because Kegels are powerful medicine for women, but there's also that counterpart called the reverse Kegel, the relaxation. And sometimes if there's been traumatic incident with a birth, for instance, right, or an episiotomy or a tear, then the last thing you want to do is create more spasm and tension around that. You want to open.
That's so crazy.
It took me, sometimes they say you learn the hard way. You have to be slapped like 800 times, before you get it.
Reverse Kegel. I feel like I should put that on the description. Is there like hashtag reverse Kegel?
Yeah, I think people use that hashtag. Because the thing is, I don't want women to stop doing Kegels, but Kegels, they're like 13 different types of Kegels I teach this in my program. So you can have a reverse Kegel, you can have an overflow Kegel, you can have a regular Kegel, you can have an endurance Kegel, you can have a quick flick Kegel, right? You can have an elevator Kegel.
Like, how do you demonstrate? Like, this is such an internal...
It's all mind-body. Because the thing about the vagina and the pelvic floor right here.
Here it comes.
Here it comes.
If you are listening and not watching, you need to get to YouTube. Let's go.
This is a basket.
Yeah, sure is.
Like everything. Your trauma, your injuries, your history, right? And so in order to understand the pelvic floor, you do it through mind-body. So you really have to connect to your pelvic floor. You do it through putting your finger inside your vagina. Women are like, whoa, what? I'm like, well, if you can't put your finger inside your vagina, then why are you going to,
Why are you letting other people put their fingers in your vagina?
Exactly, right? Why are you letting other people doing that? So I teach different ways to understand how to do a Kegel by visual inspection, by touching on the perineum here, which is a really beautiful place to see if you're doing a Kegel, reverse Kegel correctly, and by putting the finger inside the vagina. It's not that difficult, but it's really understanding and having the knowledge that you can figure out what's going on with your vagina. And if you need to get help from a pelvic floor PT, definitely go do that. But even in that relationship, you have to understand what they're doing, right? So in my clinic, when I had my clinic on Madison Avenue, and I had a bunch of PTs on my team, I never, ever allow anyone, it was part of the protocol, to do something to a woman's body that the woman could not replicate for herself at home. That is called, that's called self-care, home self-care, which is the primary job of the PT is to awaken the doctor within you or the guru within you, right? So that you can go back home and then do the things that you're supposed to do, because PT is like once a week.
Sure.
Right?
That's so true. It's so true because that's for everybody part of my patients. Like, oh, my neck hurts, my knee hurts. And I go to the PT and it didn't help. I'm like, what'd you do in between sessions? It's not magic. Like, you have to do the thing. Women are so embarrassed or hesitant to talk about pelvic floor issues. I mean, you just talked about they're not even willing to touch themselves, right? Even for therapeutic reasons. So how do you encourage women to open up and talk about this? I mean, we're joking about it. We're real comfortable, but there's people listening going, oh my God, like, I wish I could talk about it. How do you encourage people to come out of their shell?
Yeah. The first thing I say is that it's very common. You're not alone.
Yeah.
A lot of women and men too, by the way, because at the end I have 40% men in my clinic.
Well, we have to talk about that in a minute.
Yeah, I know. There's a whole nother can of worms there.
We like the worms here.
Yeah, well, I know you do. That's why I'm bringing it. They feel like I'm alone. I'm embarrassed. I'm ashamed. I did something wrong. You know, I'm aging. It's part of menopause. It's part of being a mother. I mean, I heard that. I heard first, Issa, welcome to motherhood. Then I heard, oh, Issa, you're going through the change because you had a baby at 41. I'm like, really? It's all my hormones? Can't be a physical thing that's happening with me. It has to be. So it's getting them to understand that what they're experiencing is very common.
Yeah.
But it's not normal. And then educating them about like the pelvic floor and how to visualize it and how to touch it and how to understand that society, what's been handed down through the lineage, through the cytoplasm, it's all about shame. And coming into terms with the fact that this part of your body, just like every other part of your body, deserves to be loved and touched and exercised and taken care of, right? Before something gets bad, right? Because we wait for the shit to hit the ceiling before we,
Absolutely. Oh my, and plus, I mean, I guess if they've already found you, then they're kind of on the journey already as well, because they've already found you. But you're right, most people will wait until it really falls off. And we really normalize on wellness. And I think part of that, I was just talking about this with someone yesterday. You know, you go to your doctor's office, MD, MP, whatever, and you say, I'm coming here for my wellness visit. And you do the blood work or whatever, and everything comes back normal. And you think the word says wellness, that you must be well, but you're not well. You're just not sick. Right? So same thing with you. You went to this visit. They couldn't find a pathology. There was nothing wrong with your pelvic floor. There was nothing wrong with your vagina, but you were not well. Your vagina was not well. And so we really have to get rid of this idea that just because nothing is found, that does not mean you're well. It just means they didn't find anything. Like, it's so important. I'm loving that people find you just the way they find me. Unfortunately, like you said, they find us when they're desperate, because they have to, like, the first few years, like, okay, well, maybe it is my age. Maybe it is because I have kids. Maybe it's because I'm hormonal. So, like, you know, what do you expect? You're 40, you're 50, you're 60. So eventually you have to feel so unwell that you have to be like, okay, no, this is not that. You know, even you, like, how many years or months did it take you till you got from, you know, your Dr. Roadshow to like figuring out? How long did that take?
At least 4 or 5 years.
Yeah, 4 or 5 years. Yeah,
because I trusted the doctors, you know.
Yeah,
I'm not bashing doctors.
100%.
Sometimes they just don't get it. They're not educated on this level. I mean, it's no fault of their own. Being pelvic floor therapy, and it's not taught in medical school. You know,
it's a different tool. They have.
It's a whole nother. Yeah.
And we have different tools, and all the tools should work together. Definitely no bashing, but like all collaboration. So then at some point you said you had a clinic with kind of hands-on, no pun intended. And then you decided to close that and switch to online. Is that what happened?
Yeah, absolutely. Well, there was a little story in there.
Let's go. I love your story. Such a good storyteller.
Yeah. Thank you. By the way, I love what you just said about the wellness thing, because we really need to that is the single most important thing about these wellness checkups that a lot of us don't understand. And then we leave there thinking, oh my God.
Yeah.
What is it?
It must be crazy.
I must be crazy.
They said everything was fine. Yeah. It takes people like an average 4 to 5 years to people who have, you know, out of the box diagnosis, 4 to 5 years before they finally get their answers.
Yeah.
On average. That's crazy.
It's insane. It's absolutely insane.
Now tell me your story, because I love your stories about your clinic. You said why.
Oh, so my clinic. So I was a super successful clinic, probably, you know, the only Latina on Madison Avenue, just kicking ass and taking numbers, you know. Women too, because a lot of those clinics were owned by men. And I was feeling fine and super successful. And I really wanted to bring this messaging to a more global audience. I wanted to bring this to places they call desert places that don't have anything. You have to drive like 8 hours for PT. And I wanted to bring this messaging more global. But you know how they say that sometimes everything happens for a reason?
Sure.
So I always had that in the back of my mind. I said, I need to go bigger. I need to help more women. I need to bring this information out there. So I go and I don't know, I'm in the Catskills. I go to the Catskills a lot. I go to Woodstock a lot. And I come back one day and I'm floored on the floor. I don't know what's wrong. That's a whole nother experience. And I'll tell you about that another time. That's a great story. It's about Lyme disease. And I'm sitting there on my deathbed with Lyme. And I'm like, I either can go and fall into this abyss, which was really horrible. Like I couldn't even like feed myself. I couldn't go up the stairs. I lived on the duplex. So going up the stairs to my apartment in Brooklyn was hard. And at that moment, I said, this is the sign that I've been waiting for, right? This moment on my deathbed, this moment where I can't feed myself, I can't take care of my kid. And I said, right there and then, I said, I got to make it easier for myself. I'm working too hard. I'm exhausted. I'm giving everything I can to this clinic. I've been in the clinic for 12 years, always booked to like, you know, I couldn't even close it because I was that booked. Okay. I had to wait to finish all the appointments. Okay. And then I said, that's it. This is it. I've been wanting to do this. I've been scared to do this. Right? Because who closes a super successful practice on
right?
Avenue?
Crazy.
Like nobody, right?
Only somebody with a purple vagina.
Exactly.
Sorry, I couldn't help myself.
No, I can't help myself with that. I mean, when that happened, it wasn't funny. But now I laugh my ass off every time I think about it. And then I just say, I'm going to go online. I knew nothing. You know nothing about nothing. And ignorance is bliss.
Story of my life.
La, 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 la. I'm just going to go online.
Like the Forrest Gump of online business. I get it.
Me too. I knew nothing.
I so get it. I still get it.
It was just so ridiculous,
It's a calling. When you have a calling, you have a calling.
Yeah, it was a calling. And that's when I pivoted. I said, you know what? I'm going to pivot. I'm going to take all my protocols from my clinic and I'm going to turn them into a curriculum that women can do at home. And I'm going to become a coach, a vagina coach. And that was it. A vagina trainer, or a vagina proctor. I was actually one time.
Vagina proctor.
No, it was really interesting because one time the New York Post says, I want to interview you. I'm like, oh, shit. I should have said no, okay? Because it's the New York Post. I should have known better, right?
No, I'll do it.
So they get me on the thing with two other therapists, and they start calling us vagina proctors. And in those days, there weren't like PTs doing this online thing. So they thought that it was unethical to do that. It was unethical to call. So they wanted to disbar me, the whole thing, just because somebody called me a vagina proctor. Like, I didn't make up that name. It was the Post.
Of course. We have to tear down the person who's helping people. We have to tear them down.
Why?
I know.
Why?
It's so funny these days because like I'm writing my book now. One of the things I'm writing about is the fear that I had when I started. Because my colleagues, this is quackery, right? Like, and so when I first started out, I would like talk about water, and I would talk about sleep. I wouldn't talk about how gluten affects thyroid. I wouldn't talk about mold. I was like hiding the truth, so scared of what people would think. If you look at, people say what they want to say, but then you start helping people and more people and more people. And then you're like, I got to stop hiding this. People want more and people ask for more. But it's crazy how initially you're scared.
Yeah.
And it's crazy how many people will come for you when all you're trying to do is help people. And people are coming to you voluntarily. You're not going to people's house and say, hey, try this.
No.
People are coming to you. It's fascinating. It's a very common journey. So, and thank you for doing that because you have to overcome your fears. Mm-hmm. Like as a human, people look at us as a healer or as a leader. But like as a human at home, you're like, am I crazy? What am I doing?
Yeah.
And you have to contend with that and be like, no, I'm helping people. I'm gonna do it again. And you wake up the next day and you hear somebody tell you, oh my God, you changed my life. And you're like, all right, we go back for another day. But it's a process. And I don't think a lot of people talk about it. Like the crazy healers out there, what we have to go through as humans, as professionals, to just be like, fuck it, we're just going to help people.
It's true. And I'm so grateful for your bravery and for you being so courageous, because what you talk about is very different. And we need to right now. There is a demand, there is a call, there is a need to see things in a different light. We have so many mysterious illnesses popping up left and right. I'm like, hello, what's that now?
Yeah. Yeah.
Another one,
It's true. It's crazy. Oh my goodness. So tell me what are like some common misconceptions about like pelvic floor that maybe you hear all the time and that you address with your approach?
I think one of the biggest misconceptions, and that's a great question, is that the pelvic floor is just a vagina.
Oh, yes.
That it has no connection to nothing else. It doesn't have a connection to your diet, to your thoughts, to the way you're sitting. And the thing is that because it's so centrally located, right? But abs here, back here, and through the fascial system, the pelvic floor is the center, but it's so deeply influenced by what you think, what you drink, what you eat, how you sit.
Fascinating. So
how you maintain your posture.
So you're saying we underestimate our pelvic floor?
Totally, 100%.
I think it's just the vagina, or maybe a bladder if we think about it.
Yeah, maybe a bladder, or somebody's having fecal incontinence. They're going to think it's more rectal. But the truth of the matter is that it's so interconnected. And if we talk about the energetics and the meridian lines, there's about, I think, 17 meridian lines that travel through the pelvic floor. And it houses the first, second, I consider the third chakra as well, if you believe in the energetics of that. And the nerves. So
interesting. It's, it's so interesting because like you're pelvic and I talk a lot about the gut, and we just think, whatever, gut, you eat, sometimes you have bloating, sometimes it's burning, no big deal. It's not connected to anything. It's connected to everything. And I think I myself never appreciated until this moment of what you said, the intricacies of the pelvic floor. I'm so focused, and kind of shame on me because all I keep saying is how everything's connected, but we underestimate these core parts of our body. Oh my goodness. Everything you just said right now, I think you're so right. Anyone listening, like when was the last time you thought about your whole pelvic floor, your whole pelvic seat? It's like this, like it's the structure of like your torso, and we never think about that. We really underestimate that. And you're right. We only think about it when it's not working. UTI or, any type of that.
Yeast infections,
BV, STDs. Other than that, it's just fine. Oh my God, what a mind-blowing conversation. That's crazy. So like if someone's just listening to this and maybe they're dabbling, do you have a few like quick tips or techniques that people can incorporate in their daily lives besides Kegels, besides the classic Kegel, that they can improve their pelvic and bladder health?
Immediately, don't push when you go to the bathroom. Don't push when you pee. Don't push when you defecate. Pushing makes the pelvic floor, first of all, disrupts the whole reflexes, the voiding reflexes, okay? But it also makes the pelvic floor get tight because you're putting a tremendous amount. You're trying to release something. When we're trying to release something from the body, it has to be with ease. Anytime we push to do something, it always comes back to bite us in the ass.
That's so true.
You know that. So
true.
The reverse Kegel, the opening and the relaxing and the letting go, is important for the initiation of defecation and urination.
Wow.
A lot of women go pee, then 2 minutes later they want to pee again, right?
Yeah.
And so sometimes it has to do with incomplete voiding because they're too tight and they're doing too many Kegels and not enough reverse Kegels, or they're pushing with defecation and urination.
So interesting they push it because I know it's a lot of TMI here, but this is the topic we're going to talk about. Like sometimes you're in a super rush and you have a lot of volume, so you're like pushing it out, like because you have to just go. I'm talking about urination, right?
Yeah.
And so you're saying don't do that, just let it flow out.
Yeah.
It's so interesting. I think all of us do that, especially if we're in a rush.
And the thing about the bathroom time is sacred. When did bathroom time become unsacred and just something like to get over with very quickly, right? When
You are so right.
Involved in releasing the things that are toxic for us.
What about people who like sit there on their phone in the bathroom?
Well, that makes me absolutely insane.
Tell me why.
I have somebody like that in my family because I believe that there's people who sit there on their phone. They're not focusing on releasing and letting go. So it just becomes another distraction from what it is that you need to focus in on your body. So those people are sitting there, they're probably going to anal prolapse because they're just sitting there for like 30 minutes scrolling like this on the phone. I should do a video on that.
Yeah, but it's same thing with like, I don't want people on socials when they're eating.
Oh my God, it's
right?
terrible.
Then they're not mindful. I see my son, I also prepare a whole sandwich. And just as long as it takes to prepare a sandwich, he's choosing his show. I'm like, what are you doing? It's like, well, I can't eat without my show. And I'm like, you absolutely need to eat without your show. Like, focus on the sandwich, focus on the chewing. For myself, I really try not to eat when I'm working. It's very hard with Zooms and everything. That's people gain weight. That mindlessness, I never considered the mindlessness also of bathroom. Like, just be intentional. Take the time you need. It's not 5 hours. It's going to be a minute or two. Release and be grateful for the release if you can release, That's so interesting. And don't bring your phone in there.
Oh, please don't bring your phone to the toilet. That is a kiss of death.
Plus, that's gross.
It is, because your phone carries a lot of bacteria. It's supposed to have like the most bacteria on it than anything else.
When my clients are like, here, let me show you something on the phone, I'm like, I'm not touching your phone.
Yeah.
Keep your phone to yourself.
I think that's something that we can fix right away, and it will be absolutely game-changing. And I also, the one thing that I'm a big believer in is posture. Like, you can't be next to me. If I see you like this, I'm just going to go like gently like this up your spine. And it's my cue.
Right now, you say.
And it's terrible because my daughter, she knows. I go, and then she goes, Ma, you got to stop doing that. I'm 20. I'm like, yeah, I know.
No, never going to stop. Stop, won't stop.
Stop doing that. Because posture creates a lot of intra-abdominal pressure. So it can create the prolapse. When your posture is poor and you're sitting like this, you can create trigger points in the belly, which will give you symptoms of urgency and UTI, even though you don't have one, right?
Yeah.
And the coccyx, which is a bone that nobody ever thinks about, is a tailbone. Very important in Kegel and reverse Kegels and pelvic health, because some of the pelvic floor muscles attach to this bone. When you sit like this, it becomes weight bearing and it gets stuck inside your vagina.
What?
And that creates tension. Yeah, it gets stuck inside you. And this little bone has to move in and out as you do a Kegel. Very small amount, minute. But yet it has its own inherent motion. But if you're sitting like this, and like this and on your phone, you're going to get pelvic floor dysfunction because of the mechanics of your body. Simple. Right? So let's fix that.
And then this is like, maybe it's a little bit off script here, but we've been off script most of this show.
Yeah.
What about, I have to ask you about IC. I have a lot of people with IC, interstitial cystitis, and I treat it as a microbiome issue because we used to think the bladder's sterile. I don't know why we thought the bladder was sterile, but we know it's microbiome. And so I try to treat it the same way I treat the gut and really just help it or repopulate. But how do you treat IC?
I treat it the same way as you. I do treat the gut. I treat the gut as well through probiotics, whatever I can get them on, or I send them to a doctor like you, because I know that it's intimately connected. If your gut is off, and I love the work that you do because you always address the gut first, which is super cool because the gut is connected to bladder health and vaginal health, right?
Yeah.
It's all these three microbiomes are working together. They're not like in isolation, Definitely the microbiome, the way you're addressing is fantastic. I treat it also by decreasing inflammation inside the bladder. So we'll talk about things that could decrease inflammation. We also talk about foods that are triggering. So really super careful with the foods. IC is like, you really have to track what you're eating and be like, okay, this triggers me, this doesn't trigger me. And you do elimination and then you can bring it back in. It's not a forever thing. And most importantly with IC, I like the women to do internal work because the IC triggers the anterior wall of the pelvic floor. There's 4 walls, 1 front wall, which is the house of the bladder, back and 2 sides. And a lot of women with IC are loaded with trigger points right here. Really simple to fix. And they're loaded with trigger points and spasms inside the vagina because of the constant burning and the pain, and through the fascial system, which is the missing link to pelvic health, in my humble opinion, is creating all this downward tension in the vagina. And then, so the pelvic floor is communicating back to the bladder. We have to treat the inside of the bladder, the microbiome, but we have to treat the musculature, and then we have to go to the nutrition. Because a very complex thing to treat. And it's very difficult, but I have so many women come into my clinic. I believe that everyone with IC has to do pelvic floor work, full stop.
Amazing.
Full stop, because...
No, go ahead, please finish.
No, because of the interconnection with how the fascia and the bladder is communicating. It's like a negative crosstalk. It's inflaming one thing and the other thing is going back to inflame the other thing. And so that if you're going to fix it, you got to fix it.
You're in a loop. You're in a loop,
and we got to break the loop.
Yeah.
And also with IC, there's a lot of pushing in the bathroom. A lot of pushing.
I have someone in mind. Hopefully she's listening. I'm going to have her listen, that I want her to work with you.
Please.
Do people work with you one-on-one, or is it all group at this point for you?
At this point, it's all group, but I do see one-on-ones. I do. I don't see a lot, but I do. I like the one-on-one. It keeps me connected. I do everything virtual. I don't do in person anymore. And so, I do what I call VIP clients, and I have them come in and work with me, and they have to be sort of dedicated. Yeah. Because if I tell you to do something and you don't do it, I drop you. I'm very serious about.
No, because otherwise what are we doing? We're wasting time.
Well, wasting our time, my time.
And then there's so many people who want your time. Absolutely.
Yeah, it's really hard to get in.
Yeah.
And so, but I have online programs where I show women how to do all this work as well, so they can pick up one of those programs too.
That's amazing. I mean, but listen, I want to say something before we sign off. But before I do that, is there something that you feel like maybe I didn't ask and you want to tell our audience?
I mean, I think you asked everything because you're such a good interviewer. But I would just say one thing about pelvic health and health in general, that to trust yourself. Yes. Trust your ability and to trust your body, because when we're in a situation where they go to see you or me, we're at this body betrayal level. Everything's the body betraying me. I'm sick, this body betrayal. And so we know now that there's no innocent thoughts anymore. We know through psychoneuroimmunology that every thought has a cascade of reactions in your body. What you think, the mindset piece is very important as well. Mm-hmm. So I think trusting yourself and knowing that you got this and really not giving up. No matter what happens, you just never give up. Never give up. Yes, there's always hope. You don't have to live this way. Yeah. And of course, I'm going to put all your links and everything on the show. But I have to say one thing about this particular episode that as you were talking really came to me. And I think it's I want to bring it up to surface. It was very lovely to interact with you today. And also when I came to your show, it's like this mutual empowerment. And I see that often with women. No disrespect to the men who are listening. There's a different energy, not good or bad, just different energy and this mutual uplifting of each other. I felt it was a lovely undercurrent in this episode, and I really wanted to call it out publicly. So thank you for that, because I feel great from this episode. Thank you for that. Well, you know what? You're doing God's work, and it should be acknowledged. And people like you, and you're like visionaries. And when you go and you do a video, and I follow you, by the way. And I'm like, damn, that's so good. You're so kind. But I feel the same way about you. I think, the fact that you dedicate your life to such a niche, I have so much respect for you, and you dedicate your life to such a niche. I mean, there is a certain level, like our clients are crazy, of course, and that's why we love them. But there's a certain level of crazy among us that this is what we dedicate our crazy lives to, and we talk about it all day long. And people around us are like, "Okay, we got it. Pelvic floor, gut health, got it." But so we need humans like you on this planet. So thank you for that. I need humans like you too. So thank you. Thank you. So everyone who's listening, we're putting the links everywhere. Find Issa. If you have IC, if you're not sure what's going on, just reach out to her. If it's not 100% down there, it's not okay. It's not okay. Don't accept it. It's not your age. It's not anything. Let's get it together. Thank you again for being on the show. Oh, thank you. I love your work, and thank you. It's such an honor. I really appreciate it. Thank you. Likewise.